Welcome back to the Dave K Show. I'm David K. Gyro, your host, and glad to have you with us here on www.nerosdaily.com. We're more than happy to have you along for the ride tonight. We going down the line with an excellent lineup for tonight's show. And once again, I just want to thank you all for listening tonight. No matter we always say, whether you're listening in New Roads, the beautiful city of New Roads, the great parish of Pointe, Coupee, the state of Louisiana, the beautiful United States, and around the world, because we are on the World Wide Web with Pointe Coupee's first live internet radio broadcast. So anyway, we're making history tonight. Okay, so next up we have Pointe Coupee Homebound Health and Hospice, and we have Miss in the studio with us. We have Miss Ellen Knight and Miss Jenny Settoon. Welcome to the show tonight.
Thank you, David. Thank you for having us on. My name is Ellen Knight. I'm a registered nurse, and I work with Pointe Coupee Hospice. I've been employed with Pointe Coupee Home Health and Hospice for 26 years, the last 8 of those being with Hospice.
Okay.
And I'm Jenny Settoon. I am the social worker for both home health and hospice, and I've been with the agency for about 6 years now. Okay,
very good. Y'all are doing a great job, and in my line of work, I've run into y'all quite a few times and everything. And a lot of people don't even know about the services that y'all offer. Y'all offer so many different good things that people just don't know about. And one of the things we're doing tonight is we're trying to educate the public as to what y'all do. But what I want to ask y'all is basically, what is hospice, and how does it benefit the family and the patient?
Hospice is a model for the quality and compassionate care at the end of life. It provides the patient with comfort, compassion, and dignity, and it is also a team-oriented approach. When we admit a patient to hospice, we have multiple members on our team. Of course, the patient and the family are the most important. We have physicians, we have the nurses, we have the social worker, spiritual chaplain, we have our volunteers, and we have all the other modalities if they need services like speech therapy, physical therapy, and occupational therapy. Our belief is that each of us has the right to die with dignity and to receive the support that they need. And not only does hospice care for the patient, but we also care for the family and the loved ones as well. And the focus of hospice is caring and not curing. And it is not about giving up or losing hope. Our goal in hospice is to provide comfort care that allows people to have quality of life.
Very well said. That sums it up very, very good. Hospice wasn't always around. I mean, there was a time when we didn't have hospice, even here in Pointe Coupee Parish, and really, I don't think it was really that long ago that we were able to benefit from the hospice, deal. But maybe can you describe a situation that families had before hospice was available? What did they go through when they had a family that was dying or whatever, and they didn't have any care or support? How did that all work out?
Well, hospice, like David said, hospice has just been in our parish through our hospice for about 8 years. Prior to that, of course, we had home health that has been in this parish for over 30 years. And home health and hospice are a little different in that a person that is in home health is seeking more aggressive treatment. Mm-hmm. And when the end of life comes, they have the choice to go to the hospital. With hospice, the person and the family is allowed to be in the home and receive the compassionate care in the home, surrounded by family. And prior to hospice, people were mostly were taken to the hospital for their end-of-life care.
Mm-hmm. And who is the medical director right now? Who's heading hospice up or in charge?
Dr. Robert Helm is our medical director, and we have several hospice nurses on staff who have a lot of experience in end-of-life care and managing symptoms.
Right, so Dr. Helm pretty much oversees everything and makes sure everything's in order and everything's flowing the way it should flow.
Right. Part of the hospice regulations that we have to follow requires that we have a team meeting a minimum of every 14 days, where everyone involved in the patient's care gets together and makes sure we're all on the same page.
Right.
We discuss any new changes that have come up in the past 14 days, and Dr. Helm, the nurses, the volunteers, the chaplain, myself, the social worker, we all sit down and make sure that we are meeting every area of our patient's needs.
Right. Well, very good. Well, all the listeners out there, I want to invite y'all. We are taking live calls tonight, and we're going to try this out and see how it works. We've been trying to kind of get our little system in place and perfect it or whatever. But if you have any questions or comments that you'd like to make on the show tonight, we invite you to call us at 225 area code 638-6055. That's area code 225-638-6055. 6055, and you can also find that number on the website that you're viewing on right now, which is www.newrosedaily.com, and just look on the top part of that website and you'll see that phone number. And once again, we're more than welcome to have you make your comments or questions or whatever for our panel. Are there any if somebody has a family member, they've just been diagnosed as maybe being terminally ill or whatever, how would they get in contact with hospice? Is it recommended to them, the doctor, or how does that work?
Usually what happens is the physician makes the contact, but if a family member just wants to call us and maybe have a conference, lots of times there's multiple family members present, and we have to make sure that everybody wants the same thing for their loved one. But usually we get our referrals through hospitals and through physicians, and we get a lot of referrals by word of mouth.
Right. And so the patient, of course, ultimately makes the decision whether they want to go to hospice, right?
If the patient is mentally competent, they ultimately make the decision. If not, if they have a power of attorney, and we go down the line and make sure that is exactly what they want.
Right.
And it's important to recognize that just because a physician says that you physically meet the requirements to qualify for hospice, not everybody is emotionally ready or has the belief system that makes them appropriate for hospice. It's not a choice that works for everybody.
You're talking about the patient and the family?
Right. Not every patient and not every family is comfortable with hospice care.
Right. And why do you think that is?
I think that there's a lot of fear that comes with anything that's uncertain and unfamiliar, and death is a topic that has historically, especially more recently, been a taboo thing in our society. Right.
I'll tell you this from family experience with my family. I had a family member that was put on hospice, and she was actually taken off of hospice and is still living today, which is a pretty good story. Does that happen often?
It does happen. Frequently we'll get a patient that they really improve. We make a lot of medication adjustments. Sometimes it's really a good thing, and we do have to discharge patients.
Right.
And one thing that kind of is a misconception about hospice is people believe that you have to have cancer to have hospice, but it's not. It's any terminal diagnoses, be that cancer, heart disease, any lung disease. We have patients that have ALS, Parkinson's, many different, multiple diagnoses that people can qualify. And a lot of people do not also realize that hospice care is part of their Medicare benefit. And it was a law that was in 1983. And once you can elect your hospice Medicare benefit for the terminal diagnosis.
Really? Interesting.
And there are 3 basic criteria that Medicare sets forth for a person to qualify for hospice, and that's the physician has to say that they have a terminal diagnosis that's going to end their life in 6 months or less. And sometimes that happens and sometimes it doesn't. We have patients that we've had for a year and 2 years. You have to be comfortable with receiving your care at home. Home being your place of residence. We can do hospice in a nursing home because that's where a person lives.
Interesting.
And you have to be comfortable when the end comes that you will end your life at home, surrounded by your family and your loved ones. And those are basically the Medicare criteria. But we as a hospice team, we do a lot to make sure that the patients are comfortable and that they have the kind and compassionate care that they need at the end of life.
Wow. Very, very good. I hate to put it this way, but are there any, I guess I say success stories, but are there any stories that you can tell, maybe one sticks out in your mind where, hospice really, really made a difference in the family? It's a tragedy to have a family pass away or whatever, but it sounds like a silly question or whatever, but sometimes you get thank you cards saying, thank y'all for being there. Y'all just did a great job. Y'all just helped our family out so much. Did y'all get any thanks or anything like that on any calls or patients that you had? It's kind of a silly question, but
we get lots of thank you cards and really, heartfelt and sincere thanks from people, and a lot of people don't really understand hospice. I think it's a very misunderstood form of care. People think, oh, well, you're going to hospice and you're just giving up, but that's not it.
Right.
We have patients that, if we can, the doctors can recognize that this patient has an end-of-life disease process, and that the chemotherapy and some of the treatments that they take really, really make the quality of their life very poor.
Right.
And if you can get an honest answer and say, just go home and be happy and live with your family, and we just get so many thank you notes from people, and it's a difficult decision to make, but once I feel like that the family makes that decision, it's just like a total burden lifted off. And we do lots of interventions, as Jenny says. Lots of times the nurse really isn't the most important person they want to see. It might be the social worker, or it might be our clergy.
Right.
Have lots of end-of-life spiritual issues that they need to address. And,
right.
We get that a lot. We really do. All the volunteers just make so much difference in these people's lives.
Right.
They go
and y'all
in.
cover just the parish of Pointe Coupee? Is it a
No, we
geographical
cover
area?
a 50-mile radius. We do Pointe Coupee, Avoyelles, Iberville,
Okay.
West Baton Rouge.
Really? They didn't know that. Okay.
Yeah. And one of the things that I think is so important to recognize is that with Pointe Coupee Hospice, what we do is we carefully select what areas we cover, because the rules are that you can service a 50-mile radius as the crow flies. But we recognize that the crow flies where we can't drive.
Right.
And
Right.
so we want to make sure that we can get to our patients in a timely fashion when they need us.
Absolutely.
So that's a benefit to to having a locally based hospice agency. We're your neighbors. We live next door. We see you in the grocery store. We sit behind you in church, and we understand
right.
your needs. We want to be the people who care for you at this special transition. And, you don't have to wait for somebody to come from Baton Rouge. When you need a nurse, she's there.
Right. Very well said. Well, if anybody has any questions, or how do they get in contact with y'all, well, what's some contact information that people can get in touch with Pointe Coupee Homebound Health and Hospice?
Well, we are on the web. Our website is www.pchhh.org, and that's PCHHH for Pointe Coupee Home Health and Hospice. Our phone number is 638-5717, and we are located on Hospital Road across the street from the Regions Bank.
Okay. Well, very good. Do you have any other comments you'd like to make before we go? We have about a minute left.
One thing that is also an important factor is people don't realize is not only does Medicare cover, but private insurance also covers hospice and Medicaid also.
Okay. Interesting.
It covers a lot of extra expenses that the family and the patient usually incur. Medical equipment, any medical equipment that you need, supplies related to wound care and wound dressings are covered, and also any medicines related to your hospice diagnosis. So that's a lot of expense that the hospice agency absorbs for the patient and the family as part of the Medicare hospice benefit.
Wow, that is great. Well, I tell you what, there's just a lot of help out there for people who are in need like this, and y'all are doing a great job, and my hat's off to you. Excellent job. And it's a pleasure having y'all with us on the show tonight. And
thanks. It was great being
Thank you very much for having us on.
And I'm sure we'll have you on in the future. And we'll see y'all soon. Okay, we're going to be back on the other side of this break with the people from the Relay for Life Foundation. We're going to find out what Relay for Life is all about after this break.